Hi guys, I want to show you guys this echo just for some technical issues and things to consider when imaging someone like this. So one of the things that caught my attention was how small the cavity is. This is a rather elderly woman, 72 years old, with a very small LV cavity. So immediately what we start thinking about is whether or not there is LVOT obstruction because of either asymmetrical septal hypertrophy or just a very small underfilled left ventricle. So here she does have a significant septal bulge, and the thing that caught my eye is looking at the color Doppler across the LVOT. You can just see there's just a lot of color going in there during systole, which is pretty unusual. So immediately makes me think that, hey, maybe there is some LVOT obstruction going on. I thought I saw some SAM. I'm not so certain. I think just the whole entire mitral apparatus is shifted to the septum, and this is a little bit of a vertical window, so you can sort of distort how the heart really is looking, but I don't think there is necessarily SAM. It's just the septal bulge is really impeding into the LV. So what I was surprised to see is that here on the 5-chamber and which again you see is this turbulence with this 5-chamber and 3-chamber views, that there is really not a lot of high velocities in that area. So we're getting a LVOT velocity here of about 120 centimeters per second, which is a little bit high, but definitely not pathological. So I was a little bit surprised to see that. I guess you can argue that we're really not in axis here with the flow. I mean, again, this could be difficult to do so because of patient movement and restrictions and whatnot. So again, maybe not really quite an axis with the flow, but again, we're really just not getting very big envelopes. And I had one of the techs mentioned to me a question about measuring IVRT and IVCT, or interventricular contraction time versus relaxation time. So I would argue that this is possibly the beginning of the mitral regurgitation jet, and this is the start of the LVOT. So this would be seems relatively long, but that's what I would guess to be the IVCT. And IVRT is a little bit tougher here. Maybe this is the MR, so maybe around here would be the IVRT. I'm not so sure about this one, but it would be the difference between the mitral regurgitation jet and the LVOT outflow. So there are my thoughts regarding this case. Again, not a lot of LVOT obstruction, but things to remember that if you see a case like this with a septal bulge in a very underfilled heart, you should definitely be thinking that this person may have some LVOT obstruction. So make sure to PW carefully at the LVOT, and make sure that you can be as on axis as you possibly can to get the maximum velocity. I just also want to finally show you the IVC, which is small and collapsed. This tells you that this person is probably pretty dehydrated.